Good afternoon. Thank you for joining today's meeting on postpartum extension, dental coverage, and other changes. My name is Melanie Cleveland. I am the Communication Director for Alabama Medicaid, and I want to go over some initial items before we get started. All of your devices have been placed on mute as you joined the meeting. Please do not unmute your device at any time until we get to the question and answer time and instructed to do so. You may utilize the chat box within WebEx at any time throughout the meeting if you have a question. Please be sure that all of your questions are directly related to today's topics. We will provide a contact email at the end of the presentation. If you have questions about other areas, feel free to send me an email on that contact that I provide for you, and we will get responses for you. Please record your attendance today by dropping your name and the organization you're with in the chat box at this time. If you've joined us by phone only, you can email us at meetings with an S, meetings@medicaid.alabama.gov. Finally, today's meeting is being recorded, so this information will be posted on our website on the maternity page as well as the dental program page at www.medicaid.alabama.gov. As we get started, I want to go over today's agenda. We will give some agency updates with Barry Cameron, Deputy Director. He will discuss our return to normal operations, the E&M procedure code reimbursement, as well as proposed active cancer treatment. Next, we'll hear from Bakiba Rains, who will discuss maternal health, both the Nurse-Family Partnership, or NFP, and the proposed 12-month postpartum extension. And then finally, we'll hear from Dr. Danny Rush, who will talk about the dental coverage for adult pregnant recipients. So I will now turn this over. Barry Cameron, thank you.
Thank you, Melanie. I'm Barry Cameron, Deputy Commissioner for Health Systems here at the Alabama Medicaid Agency. I'll start today's presentation with some updates on some upcoming policy changes at Alabama Medicaid, and I'll begin with return to normal operations for the Alabama Coordinated Health Network, also known as the ACHN. After beginning operations in October of 2019, roughly 6 months in, we entered into the COVID-19 public health emergency, at which point the ACHNs pivoted to a telephonic-only model of care coordination delivery. We are announcing today that effective October 1, 2022, the ACHNs will be returning to normal operations with a hybrid model of care coordination. And what this means is that this is a combination of both face-to-face as well as telephonic care coordination delivery. What we would ask of the providers on the call, many of whom already have care coordinators embedded in their practices, we ask that you please, when appropriate, allow ACHN care coordinators into your practice when requested either by the ACHN or recipients. One of the principles of the ACHN model is to meet the recipient where they are, and we feel that this is a vital component to returning back to normal operations. So we appreciate your cooperation in advance. The second update is relative to procedure code reimbursement for E&M, or evaluation and management codes. This rate increase will be effective October 1, 2022. A provider alert was issued last week with details on these 25 codes that will be increased, again, effective October 1, 2022. This will impact providers that are currently receiving default or base rates within the agency. This rate increase will not exceed those providers that are already receiving ACHN or bump rates. I would also note that providers receiving rural rates will receive $1 more on these 25 procedure codes. Again, an alert was issued last week, and it is posted on the agency's website if you need more details. And then finally, we are announcing an increase in office visits from 14 to 32 for recipients who are currently receiving active cancer treatment. This change will be effective January 1, 2023. There will be more details coming in the form of an alert as well as other educational information, most likely within the next few months, certainly prior to January 1st. System changes are still being developed, and more details will follow on these. But effectively, in order for the recipients to qualify for this increased number of visits, they have to have an active cancer diagnosis, and they have to be undergoing current treatment. Again, more details will follow on that. I would also add that physicians will have to attest that cancer treatment is indeed being rendered. So be on the lookout for an alert more than likely in the next few months. With that, I will turn the presentation over to Ms. Makiba Rains, who will give details on maternal health.
Thank you. So, Nurse Family Partnership, NFP, as many of you are aware, this is an evidence-based community health program with over 40 years of experience, and this program has shown significant improvements in the health and lives of first-time moms and their children living in poverty. The vision for this program is a future where all children are healthy, families thrive, communities prosper, and the cycle of poverty is broken. Key goals of this program: improve pregnancy outcomes, improve child health and development, and improve economic self-sufficiency of the family. So why NFP? As I stated previously, this is an evidence-based program, and it has a long track record of consistent and substantial maternal outcome improvements. Listed below on this same slide, you'll see some of those outcomes that has been identified through NFP. I won't go through the entire list, but some of those include a 25% decrease in smoking during pregnancy, a 25% decrease in closely spaced births, a 48% decrease in infant mortality, a 34% decrease in ED, emergency department, emergency room utilization, and a 14% improvement in fully vaccinated children by the age of 2. So what measures will Alabama be watching for? We'll be looking for the timeliness of prenatal care and postpartum visits, contraceptive care, screening for clinical depression and the subsequent follow-up, decrease in the number of low-weight births, developmental screenings completed, as well as the timeliness of well-child visits. So, NFP in Alabama. NFP is not new in Alabama. It's been in existence, being provided by some private providers in certain parts of the state for about the last 10 years or so. What is new regarding NFP in Alabama is that Alabama Medicaid has now been given the authorization to cover these services effective July 1st of 2022. Currently, we have one enrolled provider, and that is UAB. Postpartum extension. You may be aware that the agency did submit a request to CMS for authorization of postpartum coverage up until 12 months. Currently, it is a 60-day period of time. We have asked for authorization to extend that to 12 months. CMS has not given us an approval at this time, so as with all updates, as soon as we know more, we'll let you know, most likely via an alert. Thank you.
Good afternoon. I'm Dr. Danny Rush. I'm the Dental Director for Alabama Medicaid. And we are announcing, effective October the 1st in 2022, we are starting dental coverage for pregnant adult recipients. This really is sort of groundbreaking for us. The coverage will be effective during pregnancy and through the end of the month of 60 days postpartum. when it, excuse me, when provided by an Alabama Medicaid enrolled dentist. Okay, dental reimbursement requirements. Okay, first thing is you, of course, verify the recipient's eligibility. And the documentation of the verification must be kept in the recipient's dental letter. And obtain an attestation, which is a self-report from the recipient that she's pregnant. The attestation must include the recipient's signature and the date. And the copy of this must also be kept in the recipient's dental record. Dental reimbursement requirements, what you do, you render the dental services, you file the claim and attach D9999, and this, we're using this as a pregnancy indicator, and it must be on the claim for it to be paid. Then you submit the claim. We have some FAQs that we have included in this presentation just to see, hopefully answer some of the questions that it's probably going through your mind. Okay, who is eligible to receive this adult dental benefit? All pregnant adult recipients who are 28, 21 years and older, excuse me, and have full current Medicaid, pregnancy or emergency Medicaid eligibility. Pregnant adults who have emergency coverage will only be eligible for emergency dental services. Pregnant women with hospital presumptive eligibility, A category PW, will only be eligible for ambulatory walk-in services. Inpatient services are not available. Okay. How will I tell if the recipient has coverage? The provider must verify the recipient's eligibility prior to rendering services. Directions for verifying eligibility are in the Provider Billing Manual, Chapter 3, under Verifying Eligibility, Section 3.2. Confirming eligibility. If they have Medicaid coverage, how will I know if the recipient is eligible for the dental benefit? Pregnant adult recipients with full or emergency Medicaid coverage should inform the dental provider that they're pregnant. Usually this is just on the medical history. This attestation must include the recipient's signature. The date of the attestation was signed and must be obtained annually. Documentation to support the attestation must be kept in the recipient's medical record. Do recipients with emergency Medicaid only have dental coverage? Yes, but it's only for emergency treatment. Non-emergency elective treatment is not covered. Documentation to support the emergency treatment, what the emergency is, must be kept in the recipient's dental record. How do I get reimbursed or paid for these services rendered to eligible pregnant adults? The provider must submit a claim to Alabama Medicaid with D9999 appended to the claim for payment processing. Will health clinics be reimbursed for these services? If so, what do I put on the claim? Yes, health clinics, including federally qualified health clinics, enrolled as Alabama Medicaid providers, can be reimbursed for these services. Health clinics must include at least one treatment code and procedure code D9999 on the claim to be eligible for reimbursement. What treatment codes are covered? Actually refer to the dental fee schedule. This is a link to it below it. And we are covering all codes that are applicable to adults that are on the fee schedule. And here's my contact. If you have any questions concerning this coverage, feel free to contact me and I'll try to provide anything I can.
So we will now open up the floor to question and answer. We'd like to have written questions so we can have a record of this. If you could submit them in the chat box, but you can also email them to the meetings, that's MEETINGS at medicaid.alabama.gov if you've joined us by phone. And we will check both the meetings mailbox and the chat box to see what questions we have. We do ask that you keep those questions related to the topics that we've discussed today. And if you have other questions, you see my email on the screen, melanie.cleveland@medicaid.alabama.gov. You can send unrelated questions to my email, and I'll try to respond as quickly as possible. So we will start now with the first question in the chat box. Will this dental coverage be effective for existing pregnant women or only to those who become pregnant after October 1st, 2022?
It will be, yes, it will be available to women that are enrolled in Medicaid right now that are already pregnant, yes.
And,
Is a copy of the D9999 available for download?
It will be October 1st. On the active date, it will be in the system.
Great. And there was a dental alert that was just published late yesterday.
Yes, it went out yesterday,
Yeah.
and it explains the same things that we're talking about here. And we also have a question, or frequently asked question page in the dental page of the provider billing manual.
And Melanie, I'd also like to mention that although we anticipate this coverage, as Dr. Rush mentioned, will extend 60 days postpartum, we are currently awaiting further clarification and guidance from CMS. So that could be subject to change, but as of right now, that is still 60 days postpartum or post-delivery.
Okay, next question. Am I correct that the pregnancy dental coverage is strictly for emergency procedures only?
If they have emergency Medicaid, that is what their coverage is, but only for emergency Medicaid. Other ones that are not emergency Medicaid, that have full Medicaid coverage, they can get any of the services that we provide at this time done.
Okay, Gretel Felton, our Deputy Director, would like to add to that.
Yes, that's correct. It is very important that providers look at the coverage that is provided when they are checking eligibility. And I believe there was one other thing that I wanted to ask Dr. Rush. There was a bullet up there about inpatient services that it was not covered. I believe that was in context of just the ones that are on the presumptive pregnancy. Everybody else that's available that has full Medicaid can get inpatient services as well for dental.
Great. If you will, remember to continue to put your questions in the chat box at this time. Okay, I don't see any questions so far.
We have one from Betty Shepard.
Okay, do maternity doctors have to do a Medicaid referral for routine dental work, or will their primary care physician need to do the referral?
At this point in time, there does not have to be a referral. At some point in the future, that is a possibility, but with the way we're starting out, it is purely on the self-attestation of the recipient.
Okay, what is the age range for dental coverage?
Oh goodness, we already have birth to 21, now to be 21 to, is it end at 55?
Will be any pregnant recipient.
Right, yeah.
Up to 60 days postpartum
Yeah,
or into
we'll have
pregnancy.
dental coverage.
And Dr. Rux, let me ask you this question, because the bullet that talks about self-reporting, they have to indicate that they're pregnant, but this will go through postpartum also. So if they're postpartum, what would they have to indicate? Is there something else that they would have to put on that?
Well, they could, I guess, indicate the end of the pregnancy, or
Yes.
when the pregnancy ended, when they delivered.
Okay, thank you.
Okay, another question has come in. What are the specific requirements of the attestation that must be kept in the patient's medical record?
Well, first off, that they did report that they are pregnant, and also have the date that they reported it, the date they're in the office, and their signature.
Okay. Will undocumented maternity Medicaid recipients receive the dental coverage as well?
Yes.
Yes, if they're eligible, and that's what he was talking about, the emergency Medicaid. They get full coverage, but only for emergencies, but they would be eligible for emergency dental services.
Okay, and a continuation from Betty Shepard, would that be in the medical or dental record?
about the attestation?
Yes, she had the question, do maternity doctors have to do a medical referral for routine dental work, or their primary care physician need to do the referral?
Well,
She says yes,
She
the
says
yes attestation.
Yeah, it would be kept in the dental record. The dentist would need to have it in their records.
Right.
Okay, this time is open for you to ask any questions you need to know. And at this time, we've answered everything in the chat box. If you'd like to try to unmute yourself now and ask a question, we just ask that you place yourself back on mute after you've asked the question. But you can unmute at this time and ask a question.
Are they muted on their computer?
No, they have to unmute themselves.
Okay.
Okay. When adding the D9999 code to our dental software, what is the description I should add to the code?
That's an unspecified procedure code. And rather than trying to invent a code for pregnancy, we used one that we currently do not cover. It will be active October 1st. But you can just add it in. If you want to do the prescription, you could put pregnancy.
Emma Levitt, thank you for the good vibes. Thank you all for the good information. We appreciate those, all that we can get. Great. Any other questions you'd like to submit? There may be a few of you not able to unmute. If that's the case, we will be patient and let you type your questions in the chat box. If we missed any questions in the chat that were further up, if you could retype those in there for us. But I think we got everybody. Okay, and no questions in the meeting box. Okay, Lori's asked, is there a specific form for the attestation?
No. If they fill out their medical history, and mine, when I was practicing, they always said, "Are you pregnant?" If they check yes on that, and it's dated and signed, that's all you need.
I know some of you are not seeing the slides, so I did drop my email address in the chat just so you can send any additional questions after today's webinar. I'm sure extra questions will come up after the webinar. Just send them to me and I'll get them to the correct location for a response for you. Yeah, Tiffany says, Lori, I think I'm going to make one specifically for these patients to sign in. By all means, that might make life a little easier for you, is just to have a form, a required form for them to fill in the blanks. Okay, good question, Katie. Where will the slides be available? If you go to medicaid.alabama.gov, the main website, and you select Programs tab, you could either go to the dental page or you could go to the maternity page. Both will have these presentations, both the recorded presentation and the PowerPoint slides will be available. And we also have on the dental page a FAQ section, or frequently asked questions. You can review a lot of these questions you've asked in detail under the FAQs. Today was quick.
Yes.
Do you guys have any more questions? Okay, well, I don't see any more questions coming in. You guys have asked a lot of good ones already, but if you do think of any additional questions, please remember to send those directly to me, melanie.cleveland@medicaid.alabama.gov, and I'll be happy to get responses back for you. Oh, I did have another question come in. Emma, thank you for taking time to share this with us. Appreciate it, Emma. Tiffany asked, how quickly would it be reported, or how will we know the deadline of 60 days postpartum?
It will just be when that decision, when the decision is finally made with that,
Yeah.
made on that.
We'll provide that in writing.
Yes.
Are you asking about when the agency will know when dental coverage would end, Tiffany, or are you asking when will we know that the patient has reached 60 days postpartum? Could be either one.
We'll provide clarification on that in writing as
Yes.
part of our
Okay.
FAQs.
Yeah.
Thank you, Julie. How will we know that we cannot treat this patient any longer? I guess is what I'm asking. So
Oh,
that's
okay.
what I was assuming.
If they have a delivery date, the month that they deliver in is not counted. That's the freebie. But the next month after they deliver, they've got 60 days following that month. Like if they delivered in January, they've got February and March.
And you would just need to ensure that you've checked eligibility before you provide any services. That eligibility should tell you if that person still is active Medicaid or not.
And that's correct. And also, they do need to report to Medicaid so that it will be in the system, because if it hasn't been reported to Medicaid yet, it will be in the system. But at this point for the dental, we are accepting self-attestation.
Self-attestation. that'll be
So we
part
need
of it.
to, you all, if they don't come up in the system, they need to report it to Medicaid so that it can be placed into the system.
Tiffany's got a lot of good input. She says, I may add that to the form as a reminder to them that they may need to report to Medicaid. Thank
That's
you.
great.
Good add.
Yep,
Yes,
yep.
that's great.
And if you're doing a form, it might be a good thing to have the conception date and also the projected delivery date on that form.
And it is important because sometimes that date changes and that delivery may be delayed, and then they need to report that to us as well so that they can get the correct information and they would have that additional time to receive these dental services.
Okay, Lori asked a good question. Should a pregnancy be lost? Dental benefits will extend 60 days post loss of pregnancy, correct?
Yes.
Correct.
That's
Correct.
right.
Okay, we'll stay on another minute or two. So if you have any burning questions, go ahead and get those submitted now.
And this is Gretel Felton. I would like to say, as far as the postpartum, once we get a date, we actually count to the 60th day. And so it actually may give them more than 2 months based on when that day is. So we calculate that once they give us the date.
Emma asked, is that regardless of how early the pregnancy was lost? Example, 15 weeks versus 30 weeks.
They'll still have the 60 days.
60 days post into the pregnancy.
That's right.
Okay, Betty, thank you for your question. Where can they get a list of dental providers that are Medicaid providers? If you go to Medicaid's main website, the one I've mentioned before, www.medicaid.alabama.gov, you'll see tabs across the top, and on the top right section, you'll see provider directory. When you click on that, you can put in different specialties. So just until we get it changed, right now it says general dentistry, so it is under G. I know that's a little bit confusing. We hope to get that changed pretty soon. It should be under D for dentistry. But right now, dentists are found under general dentistry.
Is pediatric dentistry also?
No, they're separate.
It's just general? Okay.
That's just the general dent, who will be seeing the adults.
Yes. And I'll remind you too that federally qualified health centers also have dentists available in
Correct.
certain areas that would be able to see pregnant women. We will include that list with our OB bags at the beginning of pregnancy. Thank you, Betty. That's a great opportunity to get that information out. Okay, did I miss any questions? I think I've got you all, but just in case I didn't, if you'll repost it. I just want to thank you all once again for joining today. You've given up some valuable time to be with us, and I hope we've given you some very valuable information. By all means, you have every opportunity to reach out to us even after this meeting and ask any questions that you're curious about, or visit our website and look through the programs page. The dental page in particular has a lot of good information on there. Also check the alerts. The provider alerts are posted under the newsroom. And anytime you see a change to coverage or procedure codes, those are listed in our provider alerts. If you're not already getting those, make sure that you subscribe by calling the provider line with Gainwell. So by all means, reach out to me if you have any questions about anything we've talked about today. Melanie.Cleveland@medicaid.alabama.gov. We thank you all for your time. Have a great day.